Dr. Marta Perez, OBGYN here, and welcome to my channel where I cover everything about pregnancy and birth and more every Friday. Don't forget to hit subscribe so you don't miss an important episode. Today's episode is about birth trauma. Like discussing birth trauma and raising awareness about birth trauma. What is birth trauma? So birth trauma is kind of a big umbrella term for difficulties, especially mental health difficulties, surrounding unexpected events in pregnancy or birth. These can be unexpected complications, neonatal complications, obstetric emergencies, and other events that a person experiences that really lead to the experience of trauma during the postpartum period or any period after the birth. And so I like to say birth trauma is in the eye of the beholder. There's no outside definition that I can give to a patient that encompasses exactly what causes birth trauma and what doesn't. It really depends on the individual person and their experience. And that's what's important, is this is a patient-centered diagnosis. And I like to talk to a lot of my patients about it who have undergone unexpected complications or emergencies around the time of their birth. But I also know that a variety of other things that maybe I didn't think were traumatic or someone else might not think are traumatic to the individual, and that should be supported and emphasized. I'm going to give a few examples. I've had patients who have large blood loss and hemorrhage at the time of birth, and for some, coming through to the other side of that did not affect them and cause birth trauma. But for other ones, it did. Another thing is that something that isn't even a complication can really cause a trauma for patients. For example, some patients' labors are very quick, precipitous labor and birth. They start having contractions and then shortly thereafter, birth happens. And for some individuals, that may be preferable. But for other people, that is not at all what they want, and experiencing the lack of control that comes from that severe pain and quickly progressing labor and birth is really destabilizing and very traumatic. So the point I want to make is that anything can be birth trauma. This is patient-centered, and I support all my patients in their reflections. The other thing about birth trauma is that symptoms can present in the postpartum period after the traumatic event happens and during the postpartum period, which is such a difficult time period for mood and mental health. But I often see that birth trauma might present for the first time or might really worsen to the extent that someone picks it up in the next pregnancy, because the next pregnancy really triggers a lot of those emotions and thoughts about the last pregnancy and birth and postpartum period. And so it's something that I try to screen my patients for during their pregnancy, because I want to know, is there something about your last birth or one of your other deliveries that you found really difficult? And so often there's a good time to talk about that in next pregnancies as well. So what are the symptoms of birth trauma? The symptoms of birth trauma can be really wide-ranging and depend on the person. In general, they include mental health difficulties that are rather similar to post-traumatic stress disorder. In fact, when I'm explaining birth trauma to patients, I say it's basically PTSD from birth and pregnancy. So a lot of the common symptoms can be having flashbacks or perseverating on specific events, overwhelming guilt, overwhelming anxiety and nervousness about specific outcomes, difficulty sleeping and replaying events in one's head, difficulty with appetite or eating, and other agitation, irritation, and other mental health difficulties that surround and may be related to a specific event or trauma. The prevalence of birth trauma isn't well studied. I've seen ranges from about 4% to 18% of individuals. And so that's a pretty wide range of people who are affected by this. And I honestly feel like it's under talked about and under screened for, and that's why I really try to do so. I want there to be more awareness. I want people to recognize if they're suffering, and so that we can intervene to try to make people feel better and have empowered and positive experiences. There's a higher risk of experiencing birth trauma if someone already has a risk of trauma in their lives before, like adverse child experiences, sexual assault, and other things. Also, if they already have a history of anxiety or depression, but again, obviously those things are linked. So there's things that put you at higher risk, but really it can happen to anyone, and it's truly your individual experience that really matters here. So if you think that birth trauma is something that has happened to you or that you're experiencing, what should you do? Well, the first thing is to talk to your OBGYN or midwife about it. This is something, again, that I feel like is under-screened for and under-recognized. So if your OBGYN or midwife isn't able to hook you up with resources, I have additional resources. The best one, I think, is Postpartum Support International, PPSI. The website is linked below. Postpartum Support International is an organization that supports postpartum mental health. They also have a hotline someone can call anytime. They have resources for both virtual meetings and virtual support, and also getting connected with mental health care in your own communities. The most important treatment is going to be the two main tenets of any mental health care. They can be done separately, but they're gonna work best if they're together, and that is therapy and medication to manage symptoms of depression and anxiety. So again, I individualize treatment with my patients. Some want to start with one or the other, and some want both from the beginning, but it's important that they know that the best thing is that those two things work together. If you are having any thoughts of suicide or hurting yourself or other people, that is a reason to immediately access the suicide prevention hotline, which I'm displaying right here. If you feel like your symptoms of anxiety and depression are ramping up, please contact Postpartum Support International. Get connected with resources right now. If you can find a reproductive health psychiatrist or therapist in your area, I highly recommend them. This is a growing field in the mental health world, and I really love all of the ones that I have met and think it's so important. They specialize especially in pregnancy loss, birth trauma, infertility, etc., and can really be a valuable part of your obstetric and parenting life. Everyone needs a lot of support around the time of birth, the end of pregnancy, and parenting. These are really difficult transitions to do. And I think in America, they're even harder to do because we have such little support compared to other peer nations when it comes to birth and postpartum. There's just not enough societal support for this. A lot of my patients who I've diagnosed birth trauma or suggested it to didn't even know it was a thing. They're like, PTSD? I thought only people coming back from war had that. And I say, no, birth and giving birth and postpartum, they can cause PTSD as well. And so some people don't even know that they have it and don't know that their symptoms can be treated and that they can feel better. I really hope this video is helpful. Don't forget to subscribe so you don't miss videos every Friday. Thanks so much for joining me. Take care.